Good afternoon, everyone, and thank you so much for joining us today for a discussion regarding the rising healthcare and prescription drug costs with Massachusetts State Representative Christine Barber. We're going to begin in just a few moments. Please note that the webinar is being recorded and press may be on the call. Thank you so much, and we'll get started in just a minute. Good afternoon, everyone, and thank you so much for joining us today. We're excited for today's discussion with Small Business for America's Future and Massachusetts State Representative Christine Barber on healthcare costs. We're going to go ahead and get the program started. And first, we're going to watch a quick video about Small Business for America's Future.
America's small businesses account for half of all private sector jobs and are our country's main engine for employment growth. Without them, the U.S. economy will collapse. Small businesses pulled the economy out of the Great Recession. They can do the same now, but they need our help. Small business needs a strong new voice in Washington, one that will fight for Main Street, one that will make sure policymakers hear the concerns of America's entrepreneurs, and one that will ensure small businesses are at the center of our efforts to rebuild a more equitable economy. We know that the ingenuity, hard work, and determination of America's small business owners can lead to a great recovery. Small Business for America's Future is here to make sure everyone else, including our policymakers, know it too. Join us in the fight for small business and for America's future.
Great, thanks for viewing. And I'd like to begin our program by kicking it over to our Senior Advisor to Small Business for America's Future, Renee Johnson.
Hello, everyone. My name is Renee Johnson, and I am with the Small Business for America's Future team. Today, we are here to discuss the impact of rising prescription drug costs on small businesses. During this event, you will hear from a small business owner and hear details from the results of a recent National Small Business for America's Future survey showing small business owners what small business owners think that the prescription drug market is broken and that the rising cost of healthcare is slowing their growth, causing them to raise prices on the products and impacting hiring decisions. The survey of over 1,000 small business owners in the Small Business for America's Future network shows they feel that this is an urgent issue that the Biden-Harris administration and Congress must address. Before we get started, I need to cover a few items. Please know that this briefing is being recorded and there may be reporters present. After today's briefing, we'll send you a link to the recording, which will be also available on our Facebook and website. Next, I would like to introduce to you our special guest for today's webinar, Christine Barber, who is the Massachusetts State Representative for the 34th Middlesex District, which includes parts of Medford and Somerville. Through thoughtfulness and action, Representative Barber has brought her healthcare policy and public health expertise with her to the Beacon Hill, where she has fought hard for the issues that we all care about, like racial and social justice, Medicare for all, and a Green New Deal for Massachusetts. A former healthcare policy analyst, Christine is passionate about healthcare accessibility and public health impacts on her community and district-wide. Barber has brought that passion to her work in the state legislature, taking on the issue of prescription drug affordability and accountability for drug companies. Thank you so much for joining us today, Representative Barber.
Thank you so much. I'm so glad to be here with all of you virtually. I'm Christine Barber. I really appreciate that introduction and the invitation to come today. I'm the state rep for 34th Middlesex District, Somerville and Medford, and again, really honored to be here. I think all know and appreciate small businesses so much more even after this pandemic. So I have spent my career working on healthcare affordability, and I know that for small businesses, there have been struggles to afford health insurance for years and years, and increased costs. But after the pandemic, I know that one of the huge things that stands in the way of small businesses rebuilding is the increased cost of healthcare, and that's something that I think us as policymakers need to really address and take seriously. I'm really looking forward to hearing the survey results from the Small Business for America's Future, because I think it will really put evidence on what a lot of us know, that as healthcare costs going up, it's squeezing small businesses and individuals more and more, and meaning people can't get the care that they need. It's interesting because Massachusetts really is at a crossroads. We've worked so long on healthcare coverage, but it still remains unaffordable to so many. Premiums are increasing, prescription drug costs are going up, and what that means is that employers can't provide healthcare for their employees, or do so at huge cost to them, and that people can't get the care that they need. So I'm really looking forward to working with you. I actually filed 2 different bills that would address these issues. I'm going to talk really briefly about them. One is House 1247, which is the More Affordable Care Act. And what this would do is we would work to lower premiums for small businesses. So we create a reinsurance program, which is basically a way to help subsidize and lower premiums. So we create a reinsurance program that would mean that when the highest cost patients get sick, we could bring down some of the costs. Other states have done this and it has helped to bring down premiums. Maryland is a really good example. We'd also strengthen rate review, which is a way to lower health insurance rates by making sure the state's Division of Insurance is really looking at how much insurers are raising their rates each year and making sure that that goes through a transparent process and is really fair. And there's things that we could do to make that a lot stronger. So I'm excited about that. The MAC Act is what we're calling it, the More Affordable Care Act. I'm also working on prescription drug affordability. That's another huge area where we know costs are rising much more quickly than certainly than wages, but than other parts of the healthcare system. So I am working on House 729, which is the prescription drug affordability bill. And that would give us more accountability about what is going on with prescription drug prices. Like many of us, we don't really know we don't understand how prescription drugs are priced. The prices can seemingly be different based on your insurance, what pharmacy you're using, and we want to make sure that the state is able to review really high cost drugs and engage drug manufacturers in how those drugs are being priced when there are excessive price happening. So those are 2 of the bills that I'm working really closely with a coalition of businesses, grassroots groups, a lot of different groups on. There is a way that you could take action on both of them. They're actually both coming up for a hearing. And at the State House right now, as you might know, we are still doing hearings virtually. So you can see the hearing online, you can write testimony, you can also sign up and testify over Zoom. So the More Affordable Care, or MAC Act, has a hearing next week on June 29th. And the prescription drug affordability bill is having a hearing coming up on July 13th. I'd love to work with you on those, and looking forward to hearing more about your work.
Thank you so much, Representative Barber. Next, I would like to introduce to you Christy Martin, who will provide an overview on the impact of rising healthcare and drug costs on small businesses and results from Small Business for America's Future recent survey of small business owners on the issue. Christy Martin is a senior advisor to SBAF, where she provides policy and strategic counsel through her consulting firm, Highway 136 Consulting, to advance meaningful health policy. She draws on years of experience working in the public sector with private sector clients and in philanthropy. Most recently, she was vice president for healthcare at Arnold Ventures. And in this role, she managed and advised on strategy for lowering prescription drug prices. Prior to joining Arnold Ventures, she was managing director of health practice at Waxman Strategies, a consulting firm led by former Congressman Henry Waxman. Christie served several years at the U.S. Department of Health and Human Services, Office of Personnel Management and Government Accountability Office as a senior advisor, and in the Obama administration Office of Health Reform. She had primary oversight responsibility for the coordinated and timely implementation of cross-cutting departmental public health and prevention initiatives, including addressing the rising costs of drugs and setting up the Women's Preventative Services Initiative. Thank you so much, Christy, for joining us today.
Thank you so much, Renee, for that introduction. I want to take the next few minutes and talk to you a little bit about the SBAF survey that Renee mentioned at the top of our event. You know, we really have, this is our second survey that we've done this year. We fielded it in the spring and we had more than 1,000 small business owners to respond. And it was really interesting. You know, the first survey that we did talked about how important the healthcare issue was from a small business perspective. And we had small business owners rank it as the top concern of theirs, even above COVID-19 and the impact on their business. And so in this survey, we did a little bit of a deeper dive into healthcare costs and prescription drug pricing and how that is affecting small business owners' decisions and the ability to grow their business. So just a couple of highlights here, and then we're going to take a little deeper dive into each of these. About 9 in 10 small business owners say that prescription drug prices are too high. And about the same belief that this is important that policy action needs to be undertaken. And thank you to Representative Barber for joining us today and talking a little bit about her bills. And I'll make reference to those as we go throughout. You know, one of the things that I think that was most revealing about this survey is just exactly how it's impacting businesses, their ability to hire, to grow their business, and ultimately their ability to contribute to the economy. Next slide. Costs have a negative impact on small business growth and hiring, as I mentioned. It means increased cost of goods, and a half say that half of the business owners we surveyed said that they thought about changing or reducing their coverage as a result of the rising costs. For some, this is just not an option. And we will hear a little bit from Dr. Barron in a few minutes about like, what does it mean when you're actually talking to through your business decisions and you're considering how to continue offering coverage for your employees because it's the right thing to do. 15% said that they have reduced workforce as a result of rising healthcare costs. This is just a huge burden on small business. And, you know, I think that Representative Barber talked about House 1247, about ways that they're trying to think through how to lower costs at the premium level to impact this. Next slide. 75% of small business owners we surveyed said providing health coverage to their employees have increased over the last 4 years. And about half of them said that they've increased more than 7%. So to put this in context, that's about 4 times the rate of inflation. So healthcare costs are growing at a much faster rate than our economy. And prescription drugs are a key driver of these costs. As Representative Barber mentioned, we know that prescription drug costs are growing at a much faster rate than other healthcare services. Next slide, please. About 1 in 3 of small business owners providing health coverage also said that they consider dropping their coverage because costs are too high. It is very hard when the costs are going up to figure out how to make everything else work in the business. And we saw this reflected throughout the survey. They considered other actions besides dropping coverage. One of them was that they also agreed something should be done and to make sure that they can keep their business growing. Next slide. 66 of those surveys said that they believe the prescription drug market is not working and is in need of a major overhaul. There's a lot of action on prescription drugs going through both Congress as well as the Massachusetts legislature. Representative Barber mentioned House Bill 729, talking about transparency and review of high drug cost bills. And 93% those that surveyed think that changes are necessary and needed. There's several bills that are being considered in Congress, and we'll talk a little bit more about those and how small business owners feel about those different options. Next slide. As Renee had mentioned, most of the small businesses we survey believe that it's important for the administration and Congress to take action to lower drug costing bills. And a majority of those thought that were concerned that policymakers would not go far enough into bringing down drug costs. When we asked a little bit more about what policies that small business owners would be supportive of, we found that 81% support limited price increases based on inflation. 85% supported some type of negotiation that would apply to both Medicare and the private market. 85% said they supported eliminating anti-competitive practices and patent abuses that lets drug manufacturers have long extended monopolies without competition. And 89% said they supported capping out-of-pocket costs for drugs for Medicare beneficiaries. Next slide. A little over half of the small businesses that we talked to said that providing their coverage to their employees because of the rising costs often delayed growth opportunities. Next slide. And 15% said they had to reduce their workforce or lay off employees. For small businesses, rising healthcare costs and increasing drug prices are affecting their bottom line. It means that healthcare of their workers is at jeopardy. It means that they are going to have the trouble growing their business, and it means that our economy is at risk. Thank you so much. And if you want more information on the survey or the previous survey from SBAF, you can visit our website.
Thank you so much, Christy, for breaking that survey down. Next, we would like to turn to our small business owner, Dr. Philip Barron, who is a member of the U.S. Haitian Chamber of Commerce and recently now a member of SBAF too. Dr. Philip Barron has been in private practice since 1986. He is a graduate of the prestigious New York Chiropractic College, NYCC, and a certified lecturer there. He is a board certified diplomat by the American Academy of Neurology, DCON. As an undergraduate working on his bachelor's degree of science from SUNY, he received 1,800 hours of sports medicine experience under a certified trainer. He attends continuing education classes on a regular basis and is certified in AMA, impairment rating, and claims review. He has an extensive experience and has managed the care of over 13,000 patients. And I also found out that he has a TV show where he assists people in healthcare issues. I'm so excited to introduce you all to Dr. Barron.
Well, thank you for that introduction. I hope the microphone is working. And again, I appreciate the opportunity to come in and talk today. Obviously, healthcare issue is a complicated issue and very expensive, and it's affecting small businesses. And I think that's why we're here today, to try to see if there's some ways to improve it. I think the first thing is just to understand that there is a problem with the system and the costs. I'm in an interesting situation because I do own small business for both chiropractic and physical therapy. And so we have to hire people that need chiropractic, that need to be hired to provide chiropractic service and physical therapy. And we want to hire the top people, and to hire top people, you really need to have good benefits. And one of those benefits is to offer healthcare insurance to my employees. And that's being more and more difficult. I looked just today to see what the new price was going to be for next year, and it increased 13% once again. So again, healthcare costs to provide that for my employees is quite high. We spend for a family plan $26,000 for each family plan and per year, and $9,000 for an individual. So when you start to look at the cost of how much that costs to provide, we have to be very careful on who we hire, and it's very difficult to hire full-time employees, which was generally better. You can provide better, smoother service when you have full-time employees instead of part-time employees. But we are challenged with that. And of course, with the pandemic, we did have a reduction in workforce, trying to see if we can eventually move back to having again a workforce with some more full-time people than we have now. And I did some math just to give you an idea, because I am in an interesting position that I also see the other side of it, because we provide those services, chiropractic and physical therapy services, and we're being paid by insurance companies. So when we're being paid by insurance companies, we know how much they're paying, and we know that they've already hit rock bottom. Once the HMOs kicked in, they kept reducing and reducing how much they pay and what the coverage is going to be. And it's not just for chiropractors or physical therapists too, but even I've talked to primary care physicians and pediatricians, and a lot of these routine services are really cut to the bone at this point. And I'm sure as a patient, if you've seen doctors, you know that this is happening. The amount of time that the doctor may spend with you, or you're seeing a nurse practitioner instead of a doctor, the costs are, what the insurance company is paying is really hit the rock bottom already. So lowering costs at that level is going to be really impossible to continue to have quality service. We know that there are big cost drivers in healthcare, and it's drug cost, as you was just mentioned, surgery, of course, diagnostic testing, and insurance costs, the costs associated with paperwork, prior authorizations, things like that, really drive up the cost of insurance in general. I had done some calculations, and based on how much they pay us, when I hire a chiropractor, for example, that chiropractor would have to provide 666 chiropractic office visits just to cover their family plan health insurance. And now with the new increases that I just recalculated, is now increased to 866 chiropractic adjustments have to be provided just for that one person to get a family plan in my office. So again, these are big cost drivers, and makes it difficult to really provide, get the best quality healthcare, or get the best quality employees because of the health insurance costs. And anything that can be done to drive down the cost of the health insurance and make it more available would really help. I'm sure, again, this is not just from small businesses that provide healthcare, but all small businesses in the area will have a difficult time paying these kinds of fees. So that's really the main coverage that I wanted to point out, that it is it's a two-sided situation. Not just that the small business needs to spend a tremendous amount of money to cover healthcare costs. And if you look at these healthcare insurances too, there's the deductible now, $4,000 for a family, $2,000 for an individual, $250 after deductible for an emergency visit. So these deductibles and balances keep going up while the cost is going up to the employer. So it's really challenging. And my understanding is now Mass Health, for example, is charging $8,000 per person. So even that price is going to be going up. Many of my employees that are part-time end up getting the insurance through the Connector plan. That's a Mass Health plan that's through the Connector plan in Massachusetts. And that's certainly helpful, but people are trying to find ways to be able to create enough salary or incomes to pay for these costs. And I'm sure the price of goods is going to go up. So in the end, again, I hope that we can find a way to address the problem of increasing health insurance, because it's still going up. Every time they lower the cost to certain doctors, the overall cost goes up because the big cost drivers continue to increase. I appreciate you having me come on and share some of this information. And again, if there's any other questions you have on it, please let me know, because obviously there's a lot there in the healthcare system that needs to be addressed. Thank you again.
Well, Dr. Barron, you are right. We are going to ask you some more questions, and I'm actually going to bring back Christy. And also now I would like to bring Alex Schaff, who is the co-director of policy and government affairs of Healthcare for All Massachusetts, to join us for a brief discussion with Dr. Barron and Christy regarding the impact of rising cost of healthcare and slowing growth for healthcare, right? For small business owners. For background, Alex's work focuses on healthcare affordability, societal determinants of health, delivery system reform, prescription drugs, healthcare for older adults, and oral health integration. Before joining Healthcare for All, Alex served as the Senior Program Manager for Medicaid Strategies at Mass General Brigham, formerly Partners Healthcare, where he led the development and operation of Medicaid Accountable Care Organization. He also previously served as a Senior Healthcare Policy Advisor to U.S. Senator Debbie Stabenow, where he oversaw her healthcare portfolio and worked on passage of legislation such as the Affordable Care Act and the Excellence in Mental Health Act. He holds a BA from Vassar College and an MPA from Princeton School of Public and International Affairs. So excited to have you, Alex, and have all three of you here. And I'm going to actually start off with a question to you, Alex. As Representative Barber mentioned earlier, next week, the Mass Legislature will host a hearing regarding the impact of rising healthcare costs and discuss Mass Act. Alex, how will the Mass Act help small business owners if it is passed?
Are you talking at the, maybe I'll start for a second on the More Affordable Care Act. Is that what you're asking about? Yes. Okay. So I really appreciate that question, and we can talk about that. So I wanted to highlight two things that Representative Barber mentioned. So the first thing was the way that the More Affordable Care Act, or the MAC Act, would address costs for small businesses by creating this program to lower premiums. It's called a reinsurance program. The best way to think about it is like insurance for insurance companies. And it really helps offset the costs for the most expensive or most high-risk patients. And it's a big deal because instead of just slowing the growth in premiums, which is often what we're trying to do, it would actually have the ability to lower premiums. Rep. Barber mentioned there are some good examples in other states. While those states have focused on individual insurance programs, they've been very successful using reinsurance. So in Maryland, they were actually able to reduce premiums by between 10 and 13% for 3 consecutive years, so that it was a total of a 30% reduction in premiums over those 3 years. So that's why we think that that's one important part of it. Now, the second part that Representative Barber mentioned was having a stronger rate review process. And it's really about having a more transparent process, and one that gives consumers and small businesses, frankly, a bigger voice in the process. And it would have the ability to really push back on unreasonable or excessive premiums when they see them. And then the last thing I'll also mention, we haven't talked about before, is the bill would create essentially a specific benchmark as part of our annual process that would look just at the kinds of costs, deductibles, copays, and premiums that hit small businesses and individuals, and would hold insurance companies accountable for those costs on an annual basis. And that's another way that we can kind of keep pressure and stop premiums from rising so rapidly.
Thanks, Alex, so much for that. Christy, want to pose a question to you. The survey indicates small business owners strongly believe high healthcare and prescription drug costs are a problem, and that causes delayed business growth opportunities. How does the issue intersect with COVID-19 pandemic issue?
That's a great question, Renee. I think one thing to consider is that rising healthcare costs and rising drug prices were in place well before the COVID-19 pandemic. And what we have seen is that the pandemic has put even more pressure on the economic bottom lines of small business owners. And as a result, I think it's escalated the issue. It has means that, like, as their revenues are going down because they're trying to be responsive to the economic downturn or the implications of, what the pandemic has done to our economy. Their drug prices are not going down, and their healthcare costs are not going down. In fact, they're probably going to rise. And so I think it just puts more pressure on, this is an issue we need to solve and we need to think through, because it will be here after the pandemic. And unless we do something, they're going to continue to put a lot of pressure on small business owners.
Thank you so much for that, Christy. Dr. Barron, as a small business owner, if let's say Congress or even the Massachusetts legislature were to reduce drug prices, what would that mean for your business and your workers?
Well, I think if they can really lower drug costs, that's, as I mentioned, one of the big drivers of the insurance cost. Like I mentioned, surgeries, diagnostic testing, and general health management are really the big cost drivers. And if they can lower the cost of drug costs, then of course the prices will go down for coverage, and I'd be able to hire people with less sort of anxiety, knowing that it'd be very difficult to justify the hiring of somebody knowing that I have to give healthcare insurance to the employee, and again I have to compete with other big corporations, the multi-billion-dollar corporations, where they can offer maybe these kinds of benefits more easily.
Appreciate that. Christy, yesterday the Senate Finance Committee Chairman Ron Wyden introduced principles for drug pricing reform, which also are illustrated in the SBAF recent national survey of small business owners, showing rising healthcare costs are stifling their growth and leading to higher prices. What do these principles mean, and how will they impact Massachusetts small business owners potentially?
Sure. So they raised 5 principles. One of the principles had to do with negotiating. One had to do with competition within the marketplace. Another one had to do with rising increases on prices and for drug prices year over year. Another was around innovation and how to support innovation and investments in innovation in the pharmaceutical market. And the 5th one was how to lower out-of-pocket costs for patients. I think for small business owners, one of the key takeaways from those principles is there were several references about taking Medicare policy proposals like negotiation, inflation-based rebate penalties, which would penalize pharmaceutical companies when they increase their prices faster than inflation. They would extend those to the private market and commercial insurance plans, which means for small business owners, those policies would be baked into their plans and would help to lower costs for them directly. And so, I think that there's a lot of things in there that they can be supportive of and can address some of the issues that have been raised, both in our survey, but also that we've heard directly from business owners like Dr. Barron. And, I think a lot of Massachusetts business owners really are in a good position because they have a very important senator that sits on the Senate Finance Committee, Senator Elizabeth Warren. And so letting her know that these are important provisions and that healthcare costs and prescription drug costs are an important issue for small business owners is a really key to making sure we can get drug reform done.
Thank you, Christy. Alex, what are ways small business owners can help advocate for policy change that would reduce prescription drug costs and make healthcare affordable, and put those 2 words together there, for all? And especially, what can people do next week for the hearing? And then also, I know that you mentioned there's another hearing in July. What can people do for both of those hearings?
Sure. So I'll talk about that in a second. I wanted to jump on the point that Christy made, which I think was great. The state bill that Rep. Barber was talking about on prescription drugs takes a similar approach in some ways to the bill that's being considered in the Finance Committee. It's different, but it also looked at how a program that we actually helped implement for the Medicaid program here was able to produce a lot of savings, over $100 million in savings, through a review process of prescription drug prices. And so one of the things this bill would do now is say, well, if it works so well on for the Medicaid program, can we bring that over to the private sector side and have a similar kind of review process here and use the same kind of process to produce savings for small businesses and consumers that have private insurance. So I think that's a great parallel there. To your question about what folks can do, as Rep. Barber mentioned, there is a hearing on the MAC Act, the More Affordable Care Act, on Tuesday, the 29th. Folks can sign up to testify. It's also, you can submit written testimony. That's also an option. And if you can't make the exact time or any of those things, you can just send an email or call your state representative or state senator and just say, hey, we'd really like to support the More Affordable Care Act, the MAC Act, and this prescription drug reform bill. I'm going to yeah, there's a great, Bridget's put into the chat. It looks like how folks can do that to testify at the hearing on Tuesday. I'll also put in the chat, just as soon as I'm done talking, a link to a landing page where you can very easily send an email or make a call to your state representative or state senator on the MAC Act. So keep a lookout for that in the chat as well.
Thanks for that, Alex. Wanted to ask you one more question, Alex, because I know that there's a lot happening in Massachusetts right now on this. So I just wanted to ask if you had any last words or highlights that you wanted to put out there for small business owners, as I know this is a real fight happening and we want to see some movement.
Yeah, I would just say don't underestimate the power of your voice. Representatives really care about the experience of small businesses, and your voice carries a lot of weight. So I would really encourage folks, if you have just a minute, to reach out to members. It really matters, and it makes a huge difference for folks. I also wanted to make sure to mention, I know I talked about the MAC Act hearing on Tuesday. I just wanted to say the date. The prescription drug bill will be heard in 2 weeks beyond that on July 13th. And so I want to make sure folks know that's another really important one if folks can weigh in. So don't underestimate your voice. It makes a huge difference. This is a really big issue, and representatives are really open right now, I think, to the challenges that small businesses are facing. The pandemic has highlighted that. I was struck by this, one of the statistics from the survey, that a third of small businesses were holding back on hiring, new employees because of the healthcare costs. That's a really big deal. And we hope that's something that these pieces of legislation could help ease in some way. So I'll just leave it at that, but thank you for the opportunity to talk to folks.
Well, thank you guys. Want to thank you all so much. Thank you, Representative Barber, Christy Martin, Dr. Barron, Alex Schaft. We want to also thank the U.S. Haitian Chamber of Commerce. We want to thank the Massachusetts LGBT Chamber of Commerce. And if we can actually go back to the strategic partner slide just for a quick second, want to make sure we highlight and thank all of those amazing groups who sent emails and told people about this webinar today. There we go, the Sustainable Business Network of Massachusetts as well. I want to say thank you all so much for being a part of this conversation today. We want to also appreciate all those who submitted questions and engage with us in the chat. We hope you all stay engaged with Small Business for America's Future. Feel free to visit our website or send us an email to at the address right there, which is basically would be Renee, if you will, at Small Business for America's Future. And we hope that you all enjoy the rest of your day, and please stay engaged and definitely pay attention to the hearings that are coming up. Thanks so much for your time today.
Thank you.